TS17 Global, providing national cancer care through Operation BEAM or Operation Balancing Immunity. It all started in the year 1978 when a group of Thai scientists started working on the skin of mangosteen. And from it, they isolated a series of xanthones, one of which is labeled GM1, which has 4A activities, A1 being antibacterial, A2 anti-inflammatory, A3 antioxidant, and A4 anti-cancer. In the year 2007, we announced that the health benefit from mangosteen is mainly from balancing immunity, not antioxidant activity as widely publicized. We then formed an Operation BEAM research team consisting of various disciplines of scientists, together with the #1 immunologist in Thailand, Dr. Vachara from Chiang Mai University, in order to investigate the immunological mode of action of BEAM products under the supervision of Dr. Vachara. We learn and confirm that white blood cells are responsible for the balance of body immunity. In our body, there are 20 billion up to 55 billion of white blood cells, and these white blood cells communicate with each other all the time through interleukins in a chain reaction manners. These white blood cells are divided according to their function, that is, to their ability to tackle fungus, bacteria, virus, and cancer cells, and through its ability to build up antibody to tackle antigens, and finally, T helper cell, which sends signal through cytokine to white blood cell type 1 and type 2 when they are intruders of pathogens. The T helper cells, abbreviate TS cell, in the body, when it's stimulated by cancer cell, fungus, virus, and bacteria, TS cell will become TH1. This TH1 secretes interferon gamma in TNF alpha, which stimulates the killer cell, increase its ability to tackle cancer cell, virus, fungus, and bacteria. This is the body self-defense of TH1. When there is excessive TH1, autoimmunity will result. For instance, multiple sclerosis, scleroma, and diabetes type 1. So in your body, there should be a balance of TH cell, not too much and not too little. TH cell can become when activated by antigen and parasite, TH2. This TH2 then secrete a series of interleukins, interleukin 4, 5, 10, and 13, which stimulate the bone marrow to build up eosinophil, which is a white blood cell, in order to tackle the antigen and parasite. However, when there is excessive TH2, allergy arises, so it's autoimmunity, which is a wide range of ailments in the body. For instance, arthritis, osteoporosis, oral disease, liver infection, thyroid disease, including leukemia, atherosclerosis, asthma, psoriasis, uterus inflammation, and disrupted sleep, etc., etc. In other words, there are a long series of symptoms arising from autoimmunity. Most people don't know that all these symptoms are coming from the same cause, that is from autoimmunity. So when you had 4 or 5 sets of symptoms, you take 4 or 5 sets of capsule or tablet. which eventually damage your liver and kidney. Knowing that all of them coming from the same cause, all you have to do now is reduce the common cause, that is the reduced Th2. Th cell could also become Th17, which is a new cell just discovered by scientists in the year 2008. This Th17 secretes interleukin 17 and 22, which stimulate other white blood cells in the body in order to increase the ability to tackle pathogen, fungus, bacteria, virus, and cancer. So all these pathogens will be eliminated from Th17 activities. However, again, when Th17 becomes excessive, we get severe conditions of inflammation and autoimmunity, such as psoriasis, diabetes type 1, inflamed intestine, and arthritis. T cells could become T regulator, which secrete interleukin 9 and 10 in order to regulate too high Th1, Th2, Th17. As a result, it will remedy all autoimmune symptoms arising from too excessive Th1, Th2, and Th17. However, again, when T regulator become excessive, immunity from Th1, Th17 will be lower. If you happen to try to kill cancer, cancer cell can then escape from the elimination. Now, all it's amount to is that the balance of immunity depends on the balance among Th1, Th2, Th17, and Treg. The Th17 regimen consists of Th balanced mangosteen juice and Th17 capsule. The Th balanced mangosteen juice is made to be delicious without any sugar added. There's no artificial color added, no artificial flavor added, and no preservative. Most importantly, there's no rye material which may have residual insecticide and liver toxic content of dark brown tannins. As we know that the large intake of tannins may cause bowel irritation, kidney irritation, liver damage, irritation of the stomach, and gastrointestinal pain. There has been a correlation between the esophageal or nasal cancer in human and regular consumption of certain herbs with high tannin concentration. So this skin should not be consumed over a long period of time. We get volunteers to drink the Th balanced juice for 15 days, each day taking 300 milliliters, and see what happened to their T helper cells. Now this is what happened. Th1, Th2 is affected. As a result, Th1 dominates Th2. Th1 is slightly decreased, but Th2 is markedly decreased. So Th1 dominates Th2. As a result of this, the allergy and autoimmunity will be reduced. Th17 decreased. Autoimmunity will become less severe, but the ability to eliminate pathogen is also reduced. T regulator here increases. So allergy and autoimmunity are reduced by drinking this Th17 balanced mangosteen juice. So Th17 balanced juice decrease or reduce all kinds of autoimmunity by regulating excessive Th1, Th2, and Th17. However, Th balanced juice also decreases Th17. So the ability to eliminate cancer cells will be somewhat reduced as well. However, this Th balanced juice contains alpha hydroxy acid, which can chelate free iron that promote the growth of cancer cell. It also contains hydroxycitric acid, which trap the enzyme used in the synthesis of fat that is a part of the cell wall lining. It contains the standardized content of GM1, which kills cancer cell upon impact. In addition, it has a high content of polysaccharide, which inhibit the spread of cancer cell. Therefore, the TH balance juice is used to slow down the growth of cancer cell in the pathway that is different from balancing immunity. The TH17 capsule is made from a synergistic mixture of refined extract from mangosteen, sesame, soy, centella, and guava. We get volunteer to take 2 capsules before breakfast and 2 capsules before bedtime for 15 days, and to see what happened to their T cell and T regulatory cells. And this is what happened. The green bar representing the blood sample of the volunteer who took TH17 capsule, and the yellow bar representing the blood sample of the volunteer who took placebo capsule. This is a cornflower. Now, TH1, TH2, TH17, Treg. You see that all the TH cells and Treg are affected. Now, TH1 increases. Now, the ability to eliminate fungus, bacteria, virus, and cancer cell is therefore improved. TH2 decreases insignificantly. However, the overall picture is that TH1 dominates TH2. Therefore, the allergy and autoimmunity will be reduced by the TH1 domination. TH17 increases markedly, in fact by 5-fold. So the ability to eliminate the pathogen is improved significantly. T regulator increases, therefore allergy and autoimmunity resulted from excessive TH1, TH2, and TH17 are reduced. TH17 capsule, 4 capsules a day increase TH17 by 5 times and TH1 cell by 2 times, naturally, just by taking the capsule, without any side effect. So for cancer treatment, every day we use 3 TH17 capsules before lunch, dinner, bedtime, in order to promote TH1 and TH17 to better eliminate cancer cell. And then 300 milliliter of TH balance juice in the morning in order to increase T regulator to regulate the body immunity. With this practice, the immunity is not only balanced but also dynamic. Now, Operation BEAM scientists believe that the dynamic balanced immunity is the key to the effective elimination of cancer cells. The regimen is recommended for cancer patients with autoimmune symptoms. In Thailand, a clinical study was conducted at the Faculty of Medicine, Chiang Mai University by Professor Dr. Sumitra Thongprasert. In these studies, the result is that terminal stage lung cancer patients who did not respond to chemotherapy and radiotherapy improved their quality of life and live longer than expected. In Italy and USA, where terminal stage cancer patients, including a pancreatic cancer patient who did not respond to chemotherapy and radiotherapy, improved their quality of life and live longer than expected. At this point in time, we conclude that TS17 regimen add life to time, add time to life, and creating new life for cancer patients. The TS17 regimen has been helping people who are suffering from end-stage cancer in Thailand for the past 5 years, since the year 2008. Mr. Wong Woi Sui from Malaysia came to Thailand for the regimen. He had cancer in the nasopharynx in 1994 and had an operation, but no improvement. He suffered from flu and pain over the whole body. 2 years later, his CEA, which is the cancer index, went up to 50 nanogram per ml. He went to Singapore for treatment. CEA went down to 1.5 when he was in hospital, but went up again when he came out of the hospital 2 months later. The cancer then spread to bones, spinal cord, and after all the treatments, CEA did not drop and stay at 18 nanogram per ml. This is what he said to me. All kind of supplement never helped me. I was introduced to TH Balance Mangosteen juice, which was sold in Singapore. The flu and pain symptoms disappear at a very short time. And all other mangosteen never give me any improvement. TS17 product is different. He came to see me in Bangkok to find out how he got better. I then got him to start taking 6 TS17 capsules per day, together with 2 bottles of TH Balance juice. 2 months after, the CEA went down to 3.8. The PET scan showed that there was no cancer left in the whole body, but the doctor could not believe it and advised him for a follow-up checkup in 2 months' time. And this is what happened. CEA dropped to 1.9 in 2 months after, and then 1.2 nanogram per ml 4 months after. Mr. Wong has continued using the regimen and remained in good health for over 4 years now. For colon cancer, this lady suffered from 3rd stage colon cancer. She was treated with chemotherapy but could not tolerate the side effect. TS17 capsules were used to reduce the side effect. She then can continue the chemotherapy until the course was completed. So she was cured from cancer after the treatment. Bunma had terminal stage lung cancer. He was treated with chemotherapy twice, 2 sets of chemotherapy without any effect, but there is a lot of serious side effect. He was given 3 days to live by the doctor in his village before he came to the treatment. The quality of life improved markedly after taking the regimen. Then he came to give an interview in our press conference 6 months after. He now had lived happily in the past 15 months. This gentleman here had terminal stage prostate cancer. He was paralyzed from his waist down. After being treated with radiotherapy without any result, the cancer spread to the lymph node and into his bone and destroyed his bone, and eventually the bone suppressed on the nerve. So he could hardly move from his waist down. After taking the regimen, the quality of life improved markedly. And 10 months after, he can come and give the interview in our press conference on the 6th of August. When he started using the regimen, his PSA was 100 nanogram per ml. It was reduced to 31.88 3 months after, then 1.86 5 months after, then 0.82 8 months after. Mr. Sutev has been living happily for the past 15 months now. There are lots of people in Thailand who benefited from regimen, and these are the people who are kind enough to come and give an interview in order to encourage other patients